Good afternoon, everyone. I'm here with our Director of the Department of Public Health, Dr. Ngozi Ezike, and with Illinois Emergency Management Agency Director Alicia Tate-Nadeau. Thank you all for being here, and thank you to any members of the public who have joined us online, whether through our Facebook live stream, a news organization, or illinois.gov/live video. This morning, I stood with Mayor Lori Lightfoot to announce the City of Chicago will not be going forward with St. Patrick's Day celebrations this weekend. Once again, I thank the mayor for making this tough call, the right call for the people of Chicago. I've spoken with our leaders in the General Assembly, and they've made the decision to postpone the legislative session till March 24th. We'll continue to work together to evaluate the situation and take additional steps as needed. We're also working closely with our State Board of Elections and our county authorities on the upcoming elections. I want to encourage all eligible Illinoisans to request a vote-by-mail ballot at elections.il.gov. Tomorrow is the last day to request an absentee ballot, so I encourage voters to do this as soon as possible if that's how they choose to vote. There will no doubt be other unique challenges ahead as COVID-19 progresses in our state. Late last night, the CDC released recommendations related to large gatherings and events consisting of 250 people or more. We are looking closely at this new guidance, as well as doing our own state-level analysis led by DPH and IEMA of how COVID-19 has been mitigated across the globe. We're committed to taking every precaution while ensuring the least amount of disruption to people's lives, their daily lives, as possible. Local governments should work with their health officials and emergency folks to make decisions with this guidance in mind. While we recommend that all Illinoisans take precautions, for our seniors and for our immunocompromised and otherwise vulnerable individuals, our recommendation is to think critically about attending any type of large gathering. As a reminder to our elderly residents and their loved ones, we've issued strict guidance around restricting visitors at the veterans and assisted living facilities that we control, and we are working closely with the various statewide associations to ensure that they match our efforts with similarly strict guidelines. Going into the weekend, I want to remind Illinoisans to make smart choices and continue to maintain good health practices. Remember, even if you yourself are young and healthy, your neighbors, your family members, even the people who walk the same streets of your community as you do might not be. It's on all of us to minimize spread and keep Illinois healthy. Since our update yesterday afternoon, there are 6 additional cases of coronavirus here in Illinois. As a reminder, yesterday we announced 8 new cases, including our first 2 from outside of Cook County. Our total count now is 25, but as a reminder, a number of patients have now made a full recovery. In a moment, I'll ask Dr. Ezike to elaborate on the medical details of these 6 new cases, as well as provide an update on the 19 previously announced. But I wanted to let everyone know about a public resource that we launched this week on the IDPH website. It's a tracker updated daily of the number of people currently under investigation here in Illinois for COVID-19. As you'll see if you log on to dph.illinois.gov and visit the COVID-19 page, we have a running tab of our positive tests. Again, that's now at 25, as well as our negative tests and investigations currently pending. I'm continuing to press the White House and the federal government for a rapid increase in test deployment to Illinois and to states across the nation. For the safety of our residents, especially our vulnerable populations, it's essential that our testing capability run ahead of this virus, not behind. Thank you. And now I'd like to turn it over to our Illinois Director of the Department of Public Health, Dr. Ngozi Ezike. Doctor.
Thank you, Governor. As the governor did mention, we do now have 25 cases of COVID-19 here in Illinois, and we're continuing to monitor cases as they're identified, and we'll continue to notify you. So most of the cases have been in Chicago and Cook. We do have amongst these new cases a Lake County resident in his 50s. The other 5 additional cases are in Chicago and Cook, as I mentioned. We have a gentleman in his 80s, 2 men in their 70s, a woman in her 50s, and a man in his 40s. Again, we are actively investigating these identified cases now. We are investigating the travel histories, the exposures, trying to identify any close contacts of these now known COVID cases. All of these new cases are in isolation, whether it's home or in the hospital. So with these new cases, we are seeing more spread in our community. And again, I echo the governor's comments that we need to be mindful if anyone is experiencing symptoms, has been in contact with any of these cases, that they should notify their provider. Please be reminded that local health departments are not able to perform testing for individuals. The samples do come eventually to the state lab to be run, but you still need to contact your healthcare provider if you have concerns and are experiencing symptoms. Let's remember again that our older individuals are most susceptible and have seen from reports around the world the most severe complications and unfortunately fatalities. And so we are having a close eye on our long-term care facilities and our nursing homes to restrict visitors in those locations, keep children 18 and under out of those facilities, and we are screening staff. We want all staff to be screened before they report to work in these facilities to make sure that they don't have fever, that they're not supposed to be on home isolation, that they did not recently return from one of these high-risk areas. If you are experiencing symptoms and you feel you need to go to the emergency room, please call ahead and notify someone that you will need to be met at the entrance so that we can mask and cover you, and so we don't expose additional people, additional healthcare workers, people in the waiting room. We want to make sure that everyone who comes in contact with potential cases has the appropriate personal protective equipment. We encourage people with general questions about COVID-19 to call our hotline. That number, once again, is 1-800-889-3931. This hotline is not for assessing personal symptoms. Again, you need to reach out to your provider for that. We will make sure, as we have been doing daily, to announce any positive test results. We will let you know as soon as possible when we have new cases. As always, we continue to recommend the everyday health actions to help prevent illness, to help prevent germ spread across our state. Again, you all know what those are, but it's worth repeating. Wash your hands, cover your cough, stay home from work or school or public places if you're ill, and disinfect regularly, touch surfaces frequently. And with that, I will turn it over to Director General Tate Nadeau.
Thank you, Doctor. Good afternoon. Today we convened a meeting with the School Safety Working Group to discuss the state's response to COVID-19. We shared with the group important information from the Illinois Department of Public Health and began gathering critical feedback and a handful of issues affecting our schools today. One of their priorities included the development of a flowchart to assist schools in making critical decisions about school closures or e-learning. I also want to underscore the importance of our businesses and our schools and other organizations to be reviewing their emergency plans, absenteeism policies, and cleaning procedures. If you are not already, Schools and universities should be identifying strategies for alternative learning, such as online programs, and consider postponing or canceling student exchange programs. In the business world, consider postponing or canceling unnecessary business travel. Revisit sick leave policies and schedule flexibility for your people. We also activated the Business Emergency Operations Center to ensure a healthy and robust supply chain. For example, we're looking at things like what our other business partners are, what their plans are, and how we can work together to share information. The Business Emergency Operations Center is comprised of businesses and associations throughout the state to share situational awareness and a common operating picture for coordinating responses and recovery actions. We currently have 220 individuals from 158 private sector entities, which make up all 16 critical infrastructure sectors. These players engaged in events and key components to our response and recovery operations. We are working with them to ensure that state, local, and business plans are compatible with one another. As we anticipate the potential of more cases in Illinois, we all need to make smart, responsible, educated decisions. Use common sense, avoid the spread of germs. And at this time, I will turn it back over to the governor and any questions that you might have.
Thank you, General. Happy to take any questions.
Governor,
Yes.
what's the situation in regard to large sport venues, United Center, places like that? What are you considering doing given the CDC guidance?
Well, we are talking to the team owners, where I'm also reaching out to the leagues themselves because, for example, Major League Baseball and other leagues are going to be issuing guidance to their teams. This is a challenge not just for Chicago and Illinois, but for cities and states all across the nation. So I want to make sure that I know what that guidance is going to be, or at least have some sense of that. And so we're reaching out to them. And we'll be discussing this with the city of Chicago, with the teams and leagues, and making some decisions in the near future.
Do you think there is potentially a case to be made that the venues should close for the time being?
Well, what I can say is that we're considering all options here. I think if you look back at previous epidemics or outbreaks, that's always been something that's considered. So we're taking a very serious look at that. I mean, as you know, the 1 million people that would have gathered for St. Patrick's Day was something that had to be addressed right away. We have the opening days of various teams coming up in the next couple of weeks, and so we want to make sure that we're not only considering all of the options here, but considering what those opening dates are and how it might affect those teams and leagues and the public. Most important to me, of course, is the safety of the people of our state and their health, and so I'm continuing to have these conversations, and decisions are being made.
What's the status of negotiations with AFSCME regarding allowing state workers to work from home?
We've had conversation with them, and they're ongoing.
What about the Thompson Center? Should the Thompson Center stay open?
Well, we're also looking at not just the Thompson Center, but other state facilities. For the time being, we haven't issued guidance around that. I do think it's worthwhile for us all to pay attention to the guidance by the CDC and the concentrations issue. Buildings that have hundreds and even thousands of people in them aren't necessarily buildings that need to close. It's really a question of proximity of people to one another. As you know, there's this rule of 6 feet and 10 minutes. So we're looking at what that would look like for the Thompson Center and evaluating that. We'll make some decisions around that and all the other facilities that we operate.
Governor, do you support the passage of Senate Bill 471 requiring part and full-time workers, requiring employers to give full and part-time workers up to 5 accrued paid sick days?
Well, I am supportive of paid sick leave in general, but I will say that we're looking right now, because waiting for action by legislature is perhaps waiting too long. And so when people run out of their sick time, what we're looking at is emergency rules through JCAR to activate and delve into our unemployment benefits in the state. We're also seeking from the federal government the ability to get a waiver from the able and available rule in our unemployment insurance. I think they should be doing that for the entire country, but we're seeking it for the state of Illinois and also asking them to perhaps consider declaring a state of emergency or disaster for the nation around coronavirus, which would open up that ability.
Building on that, though, do you have any thoughts about the fact that there are about, I believe there are 12 states that have that some sort of law that protects part and full-time workers in this regard, that Illinois is not one of them?
Yes, and I mean, as you know, I'm very concerned about particularly working class people and working families and the effect of not having the availability of sick time in, particularly lower wage operations. So.
Do you think primary election night parties should be scaled back, called off in light of this? Or?
What do you mean by parties when you say?
Well, victory parties from the candidate's standpoint.
Again, I would have everybody look at the CDC guidance and also make prudent decisions. I think it depends on how big a gathering you're talking about. But suffice to say, yes, of course, everybody should be looking at what their election night victory events look like and how many people might be there and giving some guidance about how many people might attend. And, there are a lot of those going around, state reps and state senators and so on, probably smaller events. Something around a presidential candidate would be much larger. You saw what happened in Cleveland when they were planning events for Sanders and Biden. They were canceled, and I think those were good decisions that were made in Cleveland. There's somebody back here.
The Thompson Center, since you pointed out all the infrastructural problems and it's an aging, very old building, does it have the proper ventilation for something like this? Is it up to code? Is it following all the guidelines for needed for a respiratory infection like this?
Yeah, so I guess I would turn it over to a doctor to answer a few of those questions, only to say that, as you know, we're going to be very careful with the safety of the people who work in this building. Right now, we have, ventilation in the building. No one thinks anything about the Thompson Center is appropriate, so I won't use that word because you've all spent time here and you know what this is like in this building. But it's it's really the proximity issue that people need to pay attention to, and that's the issue around how many feet away and how many minutes you're spending with groups of people or even with an individual. But perhaps Dr. Zike can answer a question about how much ventilation is required to.
No, when we talk about the negative air pressure rooms in the hospital, that's for established cases that we need to make sure that that air that we know is being breathed into by someone who is transmitting the virus, we have to make sure that that's not going out into the community. Again, I definitely wear a lot of hats. Building engineer is not one of them. So in terms of ventilation in the Thompson Center, I mean, there are doors, there are windows, so I think air moves, so I don't think the space itself is the problem. It's just, are there communal gatherings where there are large numbers of people in a very small space at the same time that could promote transmission if an individual had? And so that's what we'll be looking at. People in their cubicles, those are appropriately spaced away that they're not in direct contact with their employees. So looking at if you had, a meeting that assembled, 250 or 300 people. That's what we're concerned about, not so much people in their offices. Thank you.
Dr. Zike, since you're standing there, Doctor, can you please go over the cases again? And you alluded to community spread, so I'm curious to know, is that all 6 cases? Is that 4 of the cases? Give us some perspective on the 6 cases that we're facing. But if you could please go over them to make sure we have the correct information.
Yeah, so I cannot give any definitive information on these last 6. Again, the investigation is going on now, so I will know more in terms of was there a link, were they on a cruise, did they travel from a high-risk area? So compiling that information and hope to have that for you probably by tomorrow. So I can't speak specifically to that. Was there another part to your question?
Can you go over the cases just to make the age?
Oh, sorry, okay. So the first one I mentioned was a Lake County resident in his 50s. And this is the third case out of the 25 that have been outside of Chicago or Cook. Then we had a gentleman in his 80s, 2 men in their 70s, a woman in her 50s, and a man in his 40s.
You have an update on yesterday's 8 new cases. How you said 2 of them are indicative of community spread. The other 6, do you have an update on that? And also, do you have an update on the gentleman over the weekend who was in serious condition, how he's doing?
Yeah, so regarding our sickest patient, I will say that the situation is serious or critical. Very sick individual. Again, don't want it to get into too many details, but slightly improved from yesterday, but definitely in critical, very serious critical condition. In terms of our other cases, we're continuing, again, we have multiple health departments who have been dispatched, who are looking into all of that information, and I actually haven't gotten the final reports on all of those. I think right now we really have maybe one that we're pretty sure is that we couldn't find a link in terms of, maybe you could call that one community transmission. I will see out of these new ones if any of those can be added. But even if we had 1 or 2 or 3, that's definitely not evidence of widespread community transmission. We will continue to follow. We're continuing to do our sentinel surveillance. Thus far, of the over 100 samples we've done, we haven't seen that across the 15 hospitals that we're screening, but we're continuing that, and we're also waiting for information from the labs that have this test commercially available. I think we'll get a lot of useful information from the commercial labs in terms of they can do additional testing to tell us if there's evidence of community spread or cases that are not linked to any cases that we know of. So more information is coming in every day, and so we'll wait for that and share as we know.
The numbers that you're giving at quick, 3 things. One is the snapshot in time. Are they current as of, and why this time every day for the briefing? If you can give some insight on that. These numbers
I'll
are
be
current
happy to
as of
answer.
when you walk into the room, or what is the?
Yeah, so let me start with the timing of these is intended to be useful to you. So, we're happy to take any guidance that you might provide, but that is why we've chosen this time of day. When the cases are announced is really dependent upon being able to confirm the information that we have, because sometimes there's information around a positive test. It may be that we have tested it once but not twice yet. And the other issue is the confirmation of the information around the person, exactly what their age is, where they're from, which county they're from. Because remember, right away we get an indication of someone is tested positive. We want to know that right away. Then we want to try to get some information initially about where they're from and so on. All of that is confidential to a large degree, so I can't see their names, for example, or anything like that, but knowing that they're from a particular county is a very useful piece of information. We can notify county health authorities for that. But in terms of timing, it's usually by the end of the day before that we then will, because it gives us time to get that confirms, the confirmatory information that we need in order to give you accurate information the next day. Just right here, yeah.
Following on from some of your criticism of federal action, there was a New York Times post that suggests hospitals are increasingly concerned over medical supplies as this deepens and lengthens, especially in terms of mask supplies.
Yes.
What are your thoughts on that generally? And then if I could, after that, pass on to the doctor to get more of an update as to her thoughts in terms of hospitals and how prepared they are with these masks.
I'll be happy to do that, and also the emergency management leader who's done a lot of work in this regard as well. Let's see, regarding the lab. Yeah. So as you know, I've been very vocal on this subject, and I've spoken with other governors who are deeply concerned about this. Here's what's happening. We're not getting enough tests. We're not getting enough test kits. We're not getting enough RNA extraction kits, which is part of the process of doing a test, or the reagent. There is a nationwide shortage of this reagent there is one producer of the reagent. Now, this is a result of the CDC having made a decision early on to not let the best research hospitals and institutions around the United States develop their own tests. They decided essentially to reject the ability early on. They're now loosening that up because they realized they created a problem. But as a result of the early decision, there was dependence upon this one reagent, this one test method, and the result is that we have a limited number of tests. Now, we're using them appropriately. As you know, we test people when they come in with symptoms. They get tested for flu and for other things before we resort to, if they test negative on these other items, but still have the respiratory challenges and the fever, then we'll go to testing them for COVID-19. But the fact that we only have few of these and need more is indicative of a behavior on the federal government level that is unacceptable to me. So we're pressing hard. I believe the federal government is hearing it, but I haven't yet seen a reaction. Here's one of the frustrations for me. Last week, they said to us, in response to this question that I posed, that by Friday of last week, that one of the commercial laboratories would be starting to issue and provide perhaps millions of tests and make those available commercially. And then on Monday, another of the major testing companies would be doing the same. Well, it's now Wednesday, and as far as I can tell, in the state of Illinois, we have none of that. It's not being seen across the nation. We need a lot more help, and you hear very little. Yesterday, I put in calls to people at the federal government level, and I made sure they understood what my call was about, and I got no return phone call from at least two major officials that I reached out to. Now, I know they're busy, and I often have heard, well, someone's in the Situation Room, or someone's in an important meeting and they can't call the governor of Illinois back on this subject. But I'm being as loud as I can on this subject, and I think that they are going to be reactive to it. I know that many other governors are speaking the same language that I am.
Can you define like too few tests, like based on what we've seen in the spikes in population of the tests in other states and other areas? Like, are we at risk of running out or having too much?
Well, we're not rationing, but suffice to say that, like I said, we're not testing everybody that would like to be tested. We're not testing everybody earlier. In other words, you come in with some condition. We're testing for a number of other things before we would resort to this. So we need not thousands of tests, but tens of thousands and hundreds of thousands of tests available, and we don't have those today. We have been given access to thousands of tests, but we're using those as we go, and if a couple weeks go by and we don't receive help and we're not getting more tests or more of the reagent or more test kits, we are going to run out.
Governor, you said that you're considering using JCAR authority to expand unemployment rules to cover
Yes.
health insurance or sick pay. Does JCAR indeed have the legal authority to order employers to offer more sick pay?
I'm advised by our legal team that they do, and in fact, they have the authority to do it under emergency rules.
Are there plans to change any
Has a
poll?
prime time address today about coronavirus? What do you want to hear from him besides this need for the commercial testing?
Well, number one, that he's taking this seriously, because I have not heard that from the President of the United States. There are other people at the federal level who are taking it seriously. And in fact, when you go 2 levels down, and you talk to the people who are actually doing the work, they understand. But when the president, wears his, red hat in a CDC facility and talks about his own brilliance around being able to do research to determine an answer to this problem, I mean, he's not taking it seriously. And you see what he tweets about this. His people in his administration have called this a hoax. We need people to take this seriously. I hope that when he gives an address, is that later today? But when he gives an address, that he speaks to the concerns that people all across this nation have, and especially to those of us who are trying to provide the care and take care of the health and safety of the people of our states. Tell us what you are going to do to make the situation better.
Are you drawing a connection between his level of seriousness and the lack or the pace of the release of the testing kits?
I am not. I don't think that the testing kits have to do with that. But you can imagine if a president of the United States, let me back up. Decisions were made by the CDC early on that have led to this shortage that exists now. I think these are serious people at the CDC, but those decisions, for whatever reason, I don't know why they were made, to exclude research institutions from developing their own tests earlier on, have now led to, more widespread infection. So I'm not connecting it, but I am saying that if you had a leader who was insisting upon getting this work done, on getting these tests to the states, I believe that people would work even more expeditiously at getting it done. If he had been paying attention early on, he might have said, let's let the best research institutions in the states determine what tests they might be able to offer that would work. Because we have some of those here in Illinois. We would have been able to do that earlier. There's a gentleman back, yeah.
This question maybe for the doctor, but are hospitals, doctors, healthcare providers all operating under the same set of guidance with respect to testing? Who gets tested and who does not?
Yes, thank you. So the current guidance for testing for corona is specific, but allows for some interpretation. So the process, just to review, is if someone is ill and they present to their healthcare provider or the emergency department and see a provider there, that person will be assessed. That person will be assessed by their provider. If they have, we call ILI, influenza-like illness, and there happens to be travel to one of the affected areas, someone says they came off of a cruise, someone says that they were connected, to a COVID case, they will meet immediate criteria to have those specimens that are collected sent. They will, they'll talk with the local health department. Those are boots on the ground. They will get a specific PUI number and know that those specimens will be sent to the public health lab. So that's one clear case of people who get tested. If someone presents to a healthcare facility and they are really sick, they get hospitalized, they've tested for flu, it wasn't flu, they've tested for many other bacteria, virus, fungi, and cannot find an etiology, that would also be a criteria to say, look, we can't find etiology for this illness. They're critically ill. This also qualifies to be a person under investigation. So that sample would also qualify to be sent to the public health lab. Someone who says, oh, I don't feel well, I've traveled nowhere, I'm not connected to anything that's like low risk for being COVID, so that person would not qualify to have their samples sent to us because we are trying to prioritize our high-risk individuals, and so for a low-risk person, that is the one we wanted to be able to send to the commercial labs and hope that they could find out, that their status there, thinking that they're low risk and most of those would actually be negative. Is that clear?
Yeah, so just to follow up, do you need to have had previous contact with the patient or with somebody under quarantine if you test negative for influenza or negative for pneumonia but are still having, severe respiratory problems?
Right, so the people who do test negative for everything and are really ill, that's the expanded definition that we would now include. That was not there previously, but if you can't find an etiology and you're really ill, looks like a flu-like illness, that would now be added to the PUI definition. That sample could be sent to the public health lab.
Just as a matter of timing, when did that change?
The expanded guidance to include, ill people who didn't have another etiology has been in the last, I don't know my days and nights anymore, so I think that's within the last 10 days. I think that's within the last 10 days. Thank you.
Doctor, just to follow up on that earlier point about the masks.
CDC announced today that Illinois is going to receive $14 million to COVID-19 response. Any comment on that?
Well, are you talking about as part of the bill that was passed, the $14.7 million? Yeah, I mean, look, we have expended dollars in the state of Illinois on this. This is where the emergency, appropriation comes in handy. We need help from the federal government. This is one of the ways that they can help us.
What's the latest on polling places? Are there specific, if not, are there nursing homes that are being used as polling places? Are there senior-centric facilities? are those gonna be changed?
Yep. So we've worked with the boards of elections across the state. Remember, we have county clerks, and we have boards of elections, and in 102 counties. And so we've made sure that we're doing our best to move any existing polling places out of nursing homes, or to protect the nursing home patients or people living in those nursing homes, so that if there are people who want to vote, that they're not voting in proximity and bringing in something that might be communicable. Because remember, it isn't just that people might get, in a nursing home, might get COVID-19. We also don't want them to get some comorbidity, so bringing in the flu or something else. And so, for example, at the Quincy Veterans Home, which had a polling place right at the veterans, inside the veterans home, we've asked the county clerk in Adams County to move that polling place to another location nearby, so that all the people who live in the area but don't live at the veterans home can go vote, but the people at the veterans home still have the opportunity to vote themselves.
With ties in McHenry Lake County, is that person a student at any local schools or colleges?
Yeah, those are details that we would not get into, that I don't think are relevant for the public. Yeah.
What's the age,
Thank you very much.
what's the age of the patient who's serious to critical?
We gave you that, there's, ID patient.
Jordan,